Welcome, everyone, to the La Jolla Cosmetic Podcast. I'm your hostess, Monique Ramsey. Today on the podcast, I have a special patient who has had a surgery with us, and she had her surgery with Dr. Luke Swistun, and she had an interesting surgery, a thoracoplasty, which is actually, it's a posterior thoracoplasty, as I learned from Google last night, because the front one is totally different than the back one. So it's the back. She had some liposuction and a scar revision. And she's going to tell us about her experience with our practice and, why she needed to have a revision. And we're really honored that she's here to tell us. And so I want to welcome you, Regina.
Oh, thank you.
Thanks.
I'm looking forward to this podcast.
Oh, good, good. So tell us a little bit about yourself and what brought you here.
Well, it all started, I have a cousin and we're really close friends, and she had breast cancer. And then I had seen her and she had like the lipo from her abdomen and they placed it in her breast. And I thought she looked really good. And I thought, oh, wow, I'd really like lipo and a tummy tuck for myself. And so that was like the trigger. And then I had researched and I asked for different people and my physicians to recommend someone. And then I got a recommendation and I had my surgery and it kind of failed. And it was quite disappointing. And on top of the failure, I got septic. And so then I was in the hospital for 2 weeks.
Oh my gosh.
And
now was that from the tummy tuck or from what part?
No,
okay.
From the tummy tuck, And then afterwards, when I got healthy after the hospital and everything, when I would dress in the morning or shower or do anything, I would look at myself and I was really disappointed with what had happened, that I just wasn't looking right. And then that wasn't what I was wanting. And so I started researching again for doctors.
Mm-hmm.
And I got a recommendation actually from my endocrinologist's office. And he's upstairs in this building. And so I came down and I met Dr. Swistun. And then it was like, okay, he's the one for me.
Interesting. So how much time went between the first surgeon and your surgery, and then
A year.
Okay. And was there anything different in your process of looking for that surgeon and looking for Dr. Swistun or?
Yes, a real big thing. The biggest thing actually was I was not aware that a doctor doesn't have to be board certified to do surgeries. And when I found out, my first doctor was not board certified. And even the doctor that recommended him didn't know that he wasn't. And so then in the second process, that was like the number one thing I would read and look at, and then their previous experiences and and the second part of it was what their personality was like. Did I feel like they were compassionate, caring, or was this just, this is my art and this is what I do and I'm so great at it.
Mm-hmm.
And I found everything I needed in Dr. Swistun because not only did I find his credentials really good, I also found his personality and the staff here very professional and caring, and just was a lot different experience than my first time around. And so I have regret that maybe I didn't find him, but chances are I probably would not have found him. So, but I'm happy that I did it the second time around and he was my doctor and this was my place.
Okay. So when you came to Dr. Swistun, what were your complaints that you wanted to, and issues kind of on your body that you wanted to solve?
Well, because I had the infection, I had an infection in a couple different places and I had one along the incision. And so then it was like really wide in that area. And then I had what they call the dog ears on the sides and also under my arms, because I call these things here the poochies. And I had asked my first doctor, I really would like to get rid of the poochies. And that was almost my primary thing because they've always bothered me. And I showed Dr. Swistun the incision, and he really couldn't understand what the surgeon was trying to do the first time around. And so he knew what to do. And, and I just can't believe how great I feel now. I look at myself in the mirror, I'm satisfied. I look at my poochies, I'm feeling so much better. And, it's just been a really great experience.
Well, and you're there with your sleeveless top,
I know. I'm not worried about them anymore.
I know. Isn't that the funniest thing? Like these little things become like this daily, especially in the summer, this daily thing is like, can I show my arms or can I not? What can I wear? Do I need to hide them? It's these dumb little things, but it's a big thing. And
yes.
And so he fixed the pooches.
That's right. He fixed the pooches and then he went around the back.
And so, so tell us about the thoracoplasty and what you were trying to solve there and what that surgery was.
Because I think the poochies went all the way under my arm and then towards the back. So I had a lot of extra skin. Mm-hmm. It wasn't as much fat as skin. And so, when Dr. Swistun listened to what I wanted, and then he looked both back on, under my arm and then the sides or in the back, he was like, okay, this is what I can do. And this is how you look. And he, pulled the skin and he put my arm up and, and he was very good about showing me what he could do and how to fix what my problem was. And that my original fix really didn't do anything for what I was wanting to address.
Yeah. And it's true that it's like we talk about like bra line fat or back fat. And sometimes though, to your point, sometimes it's not really that much fat. It's just extra skin. And it's like the skin on part of our back is really tight and other skin isn't that tight. It's like hanging over and you're like, why is it there? So
yes, that's exactly what my problem was.
Yeah. Cause I have the same one. So I can totally relate. I'm like, should I be getting on the schedule for this one? The things you don't know you need.
That's right.
So he extended that incision around the back. And so where is it and can you see it?
No, he actually, what he did was he went like, he just like pulled it. I don't know how he did it, but it's just here and up my arm. So he was able to pull
it's not,
all
there's
sides.
No scar on the back at all.
No, it's basically on my sides and arms. And if somebody sees me from the back, they can't see that I had anything done. And once the scars, the coloration gets back to like more natural looking, then nobody will be able to tell.
Yeah. Now, to that point, how long has it been since your surgery?
I had it, actually, I remember it was March 31st. It was my birthday.
Oh, your birthday. That's kind of a good little birthday / surgery anniversary. That's nice. So it's only been, 5 months, maybe 4 months. So yeah, those scars will mature over a whole year. People, it's so interesting to think about scars because it is a trade-off, right? But they just, over time, they really do sort of just disappear. It just takes some time to do it. Yes. Well, that's great. So your endocrinologist is the one who sent you down?
His staff. He and his staff, because I feel that I have kind of PTSD from my prior experience because of the surgery and then the hospitalization for 2 weeks and the lack of caring from my prior surgeon. And so I'm still weepy when I get to that point. And so sometimes when I go to the doctor and have visits and, they start talking and then I just get all choked up and everything. And I told them what happened. And so he and his nurse had said, oh, there's this really good surgeon downstairs. And actually they named Dr. Swistun by name. It's Dr. Swistun, if you go to him, you'll be happy. And so that they were kind of my saviors, kind of.
Well, yeah, it would be. I mean, to think about, you're going in for an elective surgery. It's a happy surgery. Yes. And right, it's not something you have to do. It's something you want to do. You're trying to accomplish some goals. And it's all a very positive thing. And you don't expect for things to go wrong. And they rarely do, but it happens. And so, and in your case, I mean, to be hospitalized for 2 weeks and to be septic and to think, things can go downhill really fast, right?
Yes. It was a worry.
Yeah. And what sent you to the hospital in the first place?
Well, so my daughter was staying with me She lives across the street. And so she arranged with her husband that she would come be with me for a few days. And I started developing a fever. And so when we called my surgeon's office, they said, and this is kind of weird, they said, "Oh, you're just constipated. Constipation will bring on a fever." And so I was thinking, okay, this is what they're telling me. I trust them. They're telling me how to handle this and what to do. And, then my cousin is a nurse, and my daughter would call her and she'd say, "No, that's not right. That's not right." And I'd be like, "No, I'm fine." And in this one, the fever went on for a few days, and they had me get a bunch of stuff and take it, and nothing was going on. And then I started kind of being delusional while I was at home. And then my daughter really got worried, and then she convinced me, "Okay, Mom, we have to go to the emergency room." So one night, and then I had called the surgeon's office and I said, "I can't make my appointment because I have a fever and I'm just, and they're like, "Oh, well, let's, go to the ER and get unimpacted, right? From being constipated." So I know this is not a pretty topic, but so I did go, and that was when I checked in. I said, "This is what's happening. I have a fever. I had this surgery," and they said for me to do this. Well, so then I went through all these tests, and then they found that I had an infection, like in my lower right side, and it was like very large. And so then they just admitted me because they said, "We have to handle it." And then I had to have it drained because there was a lot of infection going on. And by that time, it had gone through my body, and it was all in my blood and, everything. So, and I had my hospital was really great. I don't know if I can say where it was, but
Yeah.
oh, it was Palomar. They were the best.
Oh,
They
good.
treated me so well. And actually, my concern was my doctor was not affiliated with Palomar. So I was kind of like, I felt like they were doing me a favor by taking me in because I
Oh.
had this surgery. I had this infection. It was an abscess. That's what I had, an abscess. And so I was like, I know I'm not your problem, but I'm grateful because I had the hospital doctor, hospitalist. Then I had an infectious team. I had a surgeon, and so I had all three doctors coming daily
Wow.
to check on me, and and I was just really grateful because they saved me, and my son flew down from yes, literally. My son flew down from San Francisco. He stayed in the hospital with me for days because he didn't know how it would end. So Palomar was really great, and I had the surgeon there was just this amazing man, and he cared, and he made sure that everything was good with me.
Oh, that's amazing. And I would think at the time you got admitted, were you like a little out of it? I mean, to have all
Yes.
that infection going on and, maybe, yeah, I can't even imagine. So
No, and my daughter said that I had been saying some weird things. Even once they put me in the bed, she's just like, "Mom, I was so embarrassed because you were saying the weirdest things," and I'm like, "I can't help it. It
Right.
was not me." So, but then
Wow.
I got better. I got
Yeah.
back to
Yeah.
my mind was back after that.
Right. But oh my gosh, 2 whole weeks to solve
Yes.
that. And yeah, I would think having some PTSD would be part of it. But to be brave enough to say, later, I want to fix this, and to do
Well,
it again, to be thinking about, okay, taking that chance and sort of making that leap. Was that kind of a hard thing or was that an easy thing?
no, in the beginning, it was very hard. And, I made my appointment. And the good thing was, like the first doctor, my daughter did not go with me to the appointments because she said, had she have gone, she probably would have said, "I don't think he's the right doctor for you." But coming here, my appointment with Dr. Swistun, and then she went with me. And we both felt very comfortable and confident. And he talks to you like a professional, not in like giant medical terms, but his knowledge of what to do and how to handle it and what your issues are. It was just I just had confidence right away. And he knew I was afraid because there was lots of crying in his office when
Oh,
I was, every time I came, there was crying. And he understood that it was fear, but I also got very confident, and he's just a wonderful man. He's humble, yet knows so much about everything. And actually, he cares. And that was the big thing. I knew he cared. And so then I'm like, okay, I'm going to let this man handle this because I feel he's going to do a good job. He knows what he's doing, and he cares about what's going to happen to me ultimately.
Mm-hmm. And so well, two things. One is, I think you can't fake that caring attitude, right?
No, you
people
can't.
People can't fake it because it's too transparent. Like, whether somebody's actually caring or they're not, and you pick up on that right away. So then I was thinking, okay, let's talk about, so the scar revision. So the dog ears are sort of, for people in the audience to picture, on a tummy tuck scar, it's almost like they kind of poke out. The edges of the scar can
Yes.
kind of poke out, and they call it dog ears. So he
Yes.
fixed that.
I had the whole incision redone, not
Okay.
just the dog ears, the entire
The
incision,
whole
because
thing. Okay.
I had an infection in the one spot, so he kind of took that out. And the second infection was a little higher. So I had three areas of infection, and
Oh
the
my
second was a
gosh.
little higher. And he said in order to take that out, he'd have to pull too much skin. So I'm like, that's fine. So my whole incision was redone, and then he did the dog ears and took them off, and then he did my arms, and then the back with the lipo. So he had lipo in like all the areas too, because I was lumpy, I guess is the best way to put it, and I just and the other doctor offered to, do a revision for me. And I just said, absolutely not. I just didn't trust him and just couldn't do it.
Yeah. Yeah.
Wouldn't risk him again.
Yeah. That was nice of him to offer, but no, thank you. We're going to decline.
Yeah, that's right. Yeah.
And then how did you feel in the days and weeks kind of leading up to the surgery, and then sort of the time post-operatively?
It's really funny because I was fearful. However, I was feeling good about Dr. Swistun because my daughter also had a procedure here. So when we would go to visits, each would go with the other one. And I kind of got twice as many times to see him because I'd come with her and then I'd have my own. And by the time my surgery came around, I felt I really knew him and was confident. And I Googled him a lot. And so then everybody gave me the confidence level that, yes, he's good. He's the right man. We feel good that he's going to do the right thing. I was nervous, however, not really nervous. It's hard to describe. I was feeling good,
Feeling
but
good.
scared too at the same time.
Well, yeah. And that's normal. Whether you're having a revision or you're not having a revision, it's so normal to feel nervous and anxious and excited and all the things kind of.
I can't say enough positive things. And I am so grateful that I found Dr. Swistun and that he could fix my issues, and I can just live happily ever after and look at myself in the mirror and not be reminded of, what mistake I had made, because that was it. It was like I would look at myself and I would be like, why did you do that? It just looks almost worse than it did before.
Yeah.
So it was like a mistake, but now I don't have that mistake, so I'm all good.
That's interesting because, you would, I guess, be reminded every day because you're seeing it every day. And that's a hard thing. And I think it's a little thing, but it's the little thing that's big, right?
It's
Because
right.
it's every day, and
You can't escape it.
Right. And like I say, to me, it's very brave to have gone through something like that and then to be able to say, okay, but I'm going to take the bull by the horns and I'm going to do something, I mean, it is, it's, some people would just admit defeat and move on and, be upset. But I love that you were inspired enough, and like you said, I don't want to call you the guinea pig. We'll call you
but it's true.
We'll call you the trailblazer. Okay.
Okay.
So you were the trailblazer for your daughter. I'll go first as the mother. I totally get that. And so that we make sure that everything goes well.
Yeah.
And I'm assuming she took care of you after that procedure as well.
Yes. And she was amazing.
I have to think that the post-op was like night and day between the two experiences.
Yes. When I had so I had the surgery on a Friday. My first appointment here was on like Monday. I had like washed my hair. I had dressed myself. I came in and they're like, well, when did you have your surgery? I'm like, Friday. And because I felt so good. And, I mean, it was just so different. And yeah, it was night and day. And the funny thing is, my daughter like almost watched me like a hawk because she was waiting for the telltale signs. A fever. Is she talking crazy? That kind of thing. But luckily that passed. And can I just say one little thing about Dr. Swistun that really impressed me also?
Absolutely.
About him? So when I came here and first Kayla, who is his assistant, was telling me about him. And then I spoke to him about it. And Dr. Swistun, he's not in it for the money because he will not do breast implants because he doesn't think that they're good for a woman. And he thinks over time you have to have them removed and there could be complications. So rather than start that whole process, he just doesn't do it. And I'm like, wow, somebody that's not in it for the money, he's in it for what's best for his patients. And that too, I learned that right in the beginning. And that made me feel like, okay, this doctor is, he cares. He's compassionate. He knows what's right and wrong. And that really led me also to make sure that I wanted him to be my surgeon. I didn't go to anybody else. It was my first one and then Dr. Swistun. And when I met him, I knew he was right for me because I was really impressed by that. Anyone that will not do a surgery because they think it's for the best of the patient. Whereas, and breast implants are fine. That's not a problem. But he, that made me feel good about him.
Right.
That he feels that, there are other things you can do instead of that. Or, I mean, I don't know, maybe that's not an appropriate thing for today, but that's what made an impression.
But I think, but it all lends into kind of your experience with him and how the different factors that made you feel that you could trust him. And,
Yes.
He does a lot of implant removal. There's a lot of people who, for whatever reason, whether they're feeling bad or they just don't want them anymore, he removes a lot of breast implants. And so he's seen patients who have been negatively impacted by symptoms from the breast implants. And so, for him, that's just an easy decision to say, sure, they're good for some people, but for my patients, I'm, like to your point, you can do other things. You can put fat in,
Right.
You can you can augment the breast in other ways. And so it's absolutely, how you felt in the things that he said and the things that he did. And I think the ultimate test of a surgeon is if they'll turn you away because they can't help you. If whatever is happening, I remember a very beautiful older woman coming into the practice one time and she was just drop dead gorgeous and perfect. And she saw one of the doctors about some facial surgery and the doctor said, "You're beautiful. Go home." You don't know, literally, you don't need anything. And some doctors might say, "Oh yeah, let's do a little filler or let's do Botox or let's do this or let's do that, or I can revise your eyes or do a mini lift." No, go, go home. You're gorgeous. Enjoy your life, And so it comes down to morals. And I feel like, I've now been in this industry for 33 years. And
wow.
Yeah. It's a long time. But, but it does matter who you're working for and what are their morals of the kind of person they are. And, we have that shared value system too within the practice. And I think to your point earlier about kind of the staff and their experience, and it's not inexpensive to have that kind of staff around and have the kind of, accreditation for the facility and to have the best anesthesiologists, and all those things are not inexpensive. But, at the end of the day, we want our patients to have the very best experience and the very best outcomes. And the best way to get there is going to be, having staff that have been around the block a little bit and surgeons who have a good moral value system and who are really good at what they do. And we have a lot of team who've been around for so many years. And, Ruth, who's in the OR,
she's great. I love her.
She just celebrated 20 years with us.
Oh my gosh.
I mean, and then we have so many people like that and that shared value system. But yeah, isn't she fun? And she knows.
Yeah, she's wonderful.
She knows so much. And Kayla, everybody around each of the surgeons. It's a family for us. And it's also,
it feels like family. It really does.
Yeah. And it is. And it's that mutual respect, I guess. So, I feel good about it, but I'm glad you felt good about it, because that's really, at the end of the day, how do our patients feel, and the fact that you trusted us to not only take care of you, but your daughter as well.
Yeah, that was the big concern, because, she had seen me the first time around. And so she was actually much more nervous. And so for my second, then I think I was. But then when mine came, went well. And then Dr. Swistun did a wonderful job on her. She is amazing the way she looks right now. And so I'm really happy. And I'm older, so of course it's different, but she has like her whole rest of her life now that she can look great.
Right.
And so I'm glad she did it now rather than waiting.
Yeah. And feeling confident. Yeah. Well, I think from my own experience, do it earlier because you enjoy it longer.
Yes,
why not?
exactly.
And then it's something you're just not worrying about anymore. You're not thinking about it because it's a non-event, because you've already had it. You feel good, and you can take the clothes out of your closet or put the makeup on in a certain way that you feel really great. That's all about, it's only you that matters, I think, at the end of the day, for,
it is
how you want to spend your money
business
or your time. Well, thank you, Regina. This was such a good discussion. I had no idea where we were going at the beginning. I didn't know we were going to end up at Palomar Hospital. and then having Dr. Swistun come in and, make you all feeling good and being able to wear the clothes you want to wear. And
that's right. No more pooches.
Exactly.
That was a big thing.
Yeah, no, it is. These are, and like I said at the beginning, those are little things that are big things, because it's all that matters to you, and what things you're looking to accomplish. And the fact that, he was able to do, something that's just a little bit different and solve the problem, and, get you to your goal in a safe way.
Yes, in a safe way.
In a safe way. And I would encourage everybody, we'll put some links in the show notes, because to your point at the very beginning of board certification.
Yeah.
So doctors, can be board certified in a lot of different things. They might be a board certified dermatologist, but that's not a surgical specialty. That's, that they're there for skin, but there's no law that would prevent a dermatologist from doing liposuction or an eyelid lift or any of those things. And you would think that you would just assume, as a layperson, sure, there must be laws against that, right? There aren't. And so they can go to any 3-day course.
No, I know what you mean.
And get a certificate, but it doesn't mean that they're board certified in plastic surgery and that they've gone through all the testing and knowledge that you have to be board certified, and to have a board that's acknowledged by the American Board of Medical Specialties, the ABMS. So there's 26 boards, I think, that are recognized. And then you can go on their website, and we have a whole link. We have a whole page on our website about it, but we'll put the link in the show notes of where you can go look up your doctor. Because sometimes we don't know, right? They market in a certain way that they say, I'm a board certified cosmetic surgeon. And you're thinking, okay, that's right. No, it isn't. So,
they market themselves in a lot of different ways. After my situation, and I learned about that, I went home and I looked up every single one of my doctors, and I decided if any of them are not board certified in whatever their specialty is, I just won't go. And the funny thing is about the doctor I had, if you call their practice and you ask about, one of the doctors is board certified, the other doctors are not.
Oh.
And I think they have 3 or 4 additional ones. If you ask about a specific one, they will say, well, they are board eligible. When you say, are they board certified? Board eligible means they can just go sit and take their board exams. It does not mean anything more than they can attempt to do it. But when you hear board eligible, oh, that sounds like, okay,
Right.
But we don't know enough. But now I know.
Right. Well, yeah. That's and at the very, very beginning, when they come out of residency and they have to practice for 2 years before they can take their boards, they are board eligible. And it's not a bad thing, but that means they also don't have a lot of experience. But it also means they they could sit there indefinitely and
Yes.
never take
Well,
their
yeah.
boards. And that's also kind of the scary thing. But yeah, I think doing that homework ahead of time, and thank God for
Yes.
the internet, right? Because when I started in this industry, there wasn't an internet. And how did you know? Unless you asked the question, and people didn't even know to ask the question at the time. And so now at least
Yes.
you can do some homework and really in your own spare time, do that, do that in the investigatory process to make sure that everybody taking care of you, not just the surgeon, but what's the facility? Is it accredited, and by
Right.
whom? And who are the people in the OR with you? Who's doing your anesthesia? All those
Right.
things, are they kind of at the highest level? Because things don't go wrong very often. But as you know, they
Yeah.
can go wrong. And if they do, who's that team there to take care of you in that less than 1% of times that things do go wrong?
But it was a learning experience, and I just learned much more coming to La Jolla Cosmetic. And so, I mean, I tell everybody I know, oh, if you need a plastic surgeon, I know, or if you need a center, I know where to go, because
Oh, that's so nice. That's so nice. Well, I'm so glad again, Regina, that you're here to share with us, and that you're telling your story for other people, because it does matter, it for anybody out there who might be on the fence or not knowing, it's all about education, and you sharing your story really helps bring that to everybody
good.
out there.
Oh,
So
good.
I thank you
Thank you.
from the
I
bottom of
really
my
hope.
heart for doing that.
Thank you.
And for everybody listening or watching, we'll put all the links in the show notes. And thanks for listening today. And we'll look forward to seeing you on our next episode.
Take a screenshot of this podcast episode with your phone and show it at your consultation or appointment, or mention the promo code podcast to receive $25 off any service or product of $50 or more at La Jolla Cosmetic. La Jolla Cosmetic is located just off the I-5 San Diego Freeway in the Zymed building on the Scripps Memorial Hospital campus. To learn more, go to LJCSC.com or follow the team on Instagram at LJCSC. The La Jolla Cosmetic Podcast is a production of the Axis, TheAxis.io.